everyone, welcome to our Talkies, the Anjana Kumar show, and I'm your host Anjana. With me is Dr. Lysa Bijoy. She is a fifth generation Ayurvedic practitioner. She's also a medical director for a hospital in India, which is in the state of Kerala, and she's also a consultant for the Ayur Vaidya clinic here in Dubai. Thank you so much, Lysa, for coming here.
Thank you, Anjana, for your greetings.
Great. Today, obviously, we're talking about a very interesting topic, just to let you all know. Ayurveda is an age-old practice that people have been following. And today, we're going to talk about a specific disease, which is diabetes, that is affecting millions of people around the world, but also here in the UAE. Dr. Lysa, I really want to know, how can Ayurveda help diabetes?
Yes, Ayurveda has a very good role in treating or healing the condition diabetes. And we used to treat a lot of patients to reverse, we used to help them to reverse the diabetes condition.
Wow, that's amazing.
Okay. We have certain protocols in Ayurveda with the diet. It's a holistic approach what we used to give for diabetic patients. Like if you are treating a patient with diabetes, we are not at all giving only the medication. We'll be giving them a very good lifestyle advice and their daily regimen, their habits will be changing, the sedentary lifestyle will be changing, and the stress will be managing. And with all those things, the diabetes will get controlled easily.
Right.
And meanwhile, you know about the Panchakarma therapy that is mentioned in Ayurveda. We'll be giving them the Panchakarma, what is advisable for them as per the constitution.
Lovely. So just for our viewers as well, we'd love to, for example, know, let's start with the basis of what diabetes is and how does it affect us, and how this Panchakarma, remedy can actually reverse diabetes.
Yes. The normal diabetes is, as you all know, it's the insulin is incapable of doing its work properly, or insulin is lacking in our body, and that is a normal thing what we are facing with the type 2 diabetes, or what we are calling as diabetes mellitus.
Okay.
And the normal thing is what we used to give them the proper guidance and the advice for getting the reduced count of blood sugar level.
Okay.
Normally, people used to, if they are able to follow the pattern, then we can accept that patient. If the patient is not good, or the patient is not following the right advice what we are giving, we can't do anything. So major role is the patient whose willingness is the major role while treating the diabetes.
Very important, very well said. So the willingness and the cooperation from the patient to actually make a change in their life is very important, as much as the remedy that Ayurveda itself provides.
Yes.
But you did mention the Panchakarma
Yes.
remedy. Can you elaborate on that? What does it involve, and how has that been proven to actually reverse diabetes in patients?
Yes, I can explain that to you. Like the diabetes, in modern science, it's mainly classified to three.
Okay.
One is the gestational diabetes, and the one is type 1, and the next one is the type 2.
Correct.
In Ayurveda, it's named as Prameha.
Okay.
That is the name called for this diabetes condition.
I got it.
And it's having 20 different types of classifications.
All right.
And
Okay.
as per the body constitution, as you heard about, have you ever heard about the Vata, Pitta and Kapha
Yes.
in Ayurveda?
Yes,
Yeah.
absolutely.
Yeah, it's like, and Vata, that is a later advanced stage of diabetes.
Okay.
And Vatika Prameha, that is the advanced stage, that is of 4 types. Paitika is the middle part, intermediate stage of the diabetes. That comes around 6 types, and the remaining 10 comes under the Kapha. That is the initial phase of diabetes. We can call the diabetes mellitus as Madhumeha. In the classics, that is the advanced stage of diabetes.
Okay.
That will be having in the classics they have mentioned like excess urination and frequent urination, and the body is getting exhausted like that. all the classics, it's mentioned like that. We can correlate with the type 2 diabetes nowadays.
So basically, the symptoms of type 2 diabetes, as you said, is frequent urination,
Yes.
and
Excessive thirst.
excessive thirst,
Thirst.
and dryness of mouth also,
Mouth.
I believe.
Weight loss.
Yeah, weight loss, sudden
Fatigue.
unexplained weight loss.
Yes.
That's right. So the Panchakarma theory itself, like what is it and how can it reverse?
Okay. Not only the Panchakarma therapy, but the all associated advices what we used to give is about the lifestyle.
Right.
Lifestyle, stress relief. They need to manage the stress. The one and the only major culprit the diabetic patient is the stress.
Stress.
So
yeah.
for stress and all, we used to give them different types of consultations, counselings. We used to give them some meditations for relieving that stress. That is the first medication what we used to give for relieving from the stress. And the next part about the Panchakarma, it's having two phases. Right? The first one is the preliminary treatment what we used to give before performing the Panchakarma.
Okay.
So that is like for an operation, it's a pre-operative procedure.
Correct. Right.
For preparing the body for the operative procedures, the pre-operative procedures is having its own importance. So Panchakarma, for performing Panchakarma, we need to do certain purificatory treatments for our body.
Okay.
It's like oleation, external oleation. For some people, they'll be having lots of inflammation in the body.
Okay.
So we need to do some anti-inflammatory procedures for them before doing the Panchakarma therapy.
I see. Okay.
For example, I can tell you like if we are having some fever, we won't be taking biryani
Yeah.
during that time. We'll
True.
be taking very light diet.
Correct.
For performing the Panchakarma, we need to digest our body properly. Then
I
only
see.
the performance and that procedure will be good.
Interesting. So you prepare the body for the
Yes.
Panchakarma.
Panchakarma.
Yeah. Very interesting. Okay.
So that
Yeah.
will be the phase of anti-inflammatory. That is the initial phase. In that there are lots of procedures. Some dhara parisheka, like some medicated waters, some medicated kashayas or decoctions. Medicated. We will be pouring throughout our body. We will be applying some paste, medicated paste to our body, and we will be applying that to our body in the reverse direction, opposite to the hair follicles.
Okay, got it.
Such treatments will be there before performing this Panchakarma.
Oh, it's very interesting.
Yeah.
I have not heard about this.
Yeah.
So again, I know that the skin is a very important organ, right? Because the skin pores actually are very they absorb or they give out the toxins, release the toxins and absorb the nutrients that you put. So I
Nutrients.
guess that's what you're doing to prepare the body.
Yes.
Okay.
The lymphatic drainage is the main thing. We need to do the lymphatic drainage in different ways. The one among the way is the friction massage with the powder massage and all we used to give to the body. That will be making our body a little bit less inflammation in our body, and that will heal the body. So if we are having different types of poultices. Have you heard about poultices or kiris?
No,
Some
I
pouches?
haven't. No, I
that
haven't
is all
actually.
comes under the pre-operative procedure of the Panchakarma.
I see.
And some
Lovely.
applications, some paste applications on our body, some dry powder applications on our body, some different types of hot poultices that is medicated with some leaves, herbal leaves, and some oils. We'll be mixing with that, and we'll be doing the massage with that.
Amazing.
Poultices. And after that, if required, some people may require some friction massage with oils also. The oils we choose as per the constitution. What I said about that Vata, Pitta and Kapha, we'll be choosing the medicated oils as per the constitution.
Constitution of the body, of
For
the
some body.
patient's body.
Patient's body.
Got it.
Like some Vata patient, they need more heat.
Right.
They will like to the like towards the heat is more. So we'll be giving the medications with that hot potency. We'll be giving the oil with that potency. We'll be giving.
Okay.
And for Pitta dominant person, they'll be having more heat in their body. So we'll be giving the oil with the tendency to reduce the body heat.
Okay. All right.
Like that.
And then so this is also part of all the actual therapy. The Panchakarma.
These all are the normal therapies what is performing in
Right.
Ayurvedic clinics and hospitals.
And from your personal experience, like, have you seen it in your patients? Has that been reversed? Like, do you have a case study?
Definitely.
Really?
Definitely, we are having
Okay.
a very good case report. Those are having HbA1c. That's a normal laboratory finding what we can analyze the blood sugar level. HbA1c that comes around 10 or 11. We can reduce that to 5 below 6.
Oh,
5 to
really?
6, yeah.
And how long is this therapy on for?
Within 1.5 year,
Okay.
we can make the totally reverse. If the
Okay.
patient is cooperative.
Cooperative.
First thing is, yeah.
I agree. And additional to this, is there any other medication that they take, like a tablet in a tablet form, to help manage that?
Yes, we do have certain medications
Okay.
like internal medications as well as external therapies. Both the things will add upon this.
Okay.
Because initially, if you are treating with only with the medications, that will not work properly. Because our body is having lots of toxins, lots of inflammation.
Right.
Our body will not be able to accept the medications what we are giving.
Right.
That will flow.
Right.
So that won't
Okay.
get absorbed properly.
Okay.
So
Very good
after,
point. Yeah.
after cleansing our body with all
Right.
these panchakarma procedures,
Yeah.
for initiating the work, we need to
That's right.
cleanse the body. Then we can start giving the medications.
Exactly. Just to add to our viewers, because I think Ayurveda goes to the root of the problem. So
Yes.
it goes just deep down there, and that's why the cleansing process happens before the actual medication and all that is given
Yes.
to a patient.
Yeah.
Very interesting. Yeah.
Yeah, and for this panchakarma procedure, have you ever heard about what it is panchakarma? That is 5 karmas.
Okay.
5 karmas in the sense 5 different procedures.
Okay. Yeah.
We don't need to give all the 5 panchakarma procedures to a person. For some person, we can give the nasya karma itself.
Okay.
And that is a medication that we are giving to the nasal root. And that will stimulate the pituitary gland, and that will help us to regulate the hormone imbalance in our body.
See. Okay.
Like that, the treatment comes.
So the treatment, and obviously, an experienced doctor like you will also evaluate the patient, their history,
Yes.
before recommending which panchakarma therapy to apply
Therapy is
on that
applied.
patient.
Yeah.
Yeah. So
Exactly, we will be doing that through our questionnaires, and by analyzing the patient constitution, we'll be deciding, this treatment will be better for this patient.
That's
and
right.
We'll be going through that.
Doctor, earlier we were talking, right? And you made a very interesting, very, very beautiful point on how diabetes is also impacted by, obviously we've spoken about lifestyle, but within lifestyle, for example, not being aware of your bowel movement needs, or not aware of your nutritional needs. So there was a very beautiful point that Dr. Lysa made earlier, where she said about how if you do not have a disciplined timing for everything, whether it's your
Yes.
food intake or your bowel movements, all this impacts diabetes. It actually builds up.
Yes. It's like in Ayurveda, it's mentioned like 3 malas. It's mentioned 3 malas in the sense 3 waste products what our body need to excrete daily.
Correct.
The first one is the fecal matter, then second one is the urine, and the
Yeah.
third one is the sweat.
Right.
If you are not able to evacuate that properly every day, definitely that toxins will remain in our body. That will be a toxin that is produced inside our body itself. So we need to remove these toxins by daily routine practices. In Ayurveda, it's mentioned like dinacharya. Dinacharya in the sense daily routine, we have to follow certain patterns.
Right.
Like waking up early in the morning and doing all the body purification
Yes.
things in the morning without fail.
Correct.
If we are in rush or if we are in hurry, we don't need to, we are not supposed to skip those things.
Correct.
And
Exactly.
after that, only you can have the food and all those things.
Absolutely.
If possible, we can do the oil massage or powder massage from your bathroom itself. If possible, with
If possible.
for 1 or 2 days.
Right.
weekly.
Yeah.
That will be detoxifying our body daily. The hospital procedures or the clinic procedures, if that is not possible for everybody,
Of course,
for
if
all-
it's
all
not
the times,
practical, yeah.
So daily we can do it like this. That will detoxify our body, and we should be now concentrated on. We should be focused on the evacuation of our waste materials daily.
Very important point.
Yeah.
So we've heard a lot about the lifestyle issues that are so important to keep the hormone levels in check, and here Dr. Lysa has just told us how important it is. So sleep, for example, 8 hours of sleep is recommended.
Yeah, 8 hours of sleep is recommended if possible.
Yeah. Yeah, so good. So sleeping on time, waking up on time, doing your daily basic needs on time, food intake on time. So have your same time, breakfast, lunch.
Water intake.
Yes, water intake.
Water intake.
Exactly. So here's a personal anecdote actually. So in my family, I just lost an aunt 2 years ago. She lived up to 100. And she celebrated her 100th birthday, and just a week after that she passed away. And so we were all in awe, because you don't hear of too many people living up to 100 these days. And then we sort of as a family sat together and thought about, what made her live that long. And there were things that immediately came to us. So she had a routine that never changed, like every day.
Yeah.
Her breakfast was at 8 a.m., her lunch was at 12, and she never had a dinner. So it would always be a fruit or a light snack. So that disciplined lifestyle, I think, is so important.
Yes, exactly. Disciplined lifestyle will add upon to our health. That is the real investment.
Yeah,
If
that's
we
true.
are hardly working and we are earning a lot and we are spending all those monies to the
Yes,
hospitals,
yes.
that is
Absolutely.
nothing.
So, Dr. Lysa, a word of advice from you, because you're such an experienced doctor. You've seen so many patients with diabetes. What is your one key observation and that one key tip that you would like to give to our viewers and, generally?
Yeah, keep a lifestyle that should be a healthy one. That we can't blame ourselves in future.
Yeah.
Like our health is our responsibility.
Yeah.
So we need to focus on that.
Right.
And the one major thing is, if we are taking more carbohydrates and if we are continuing our sedentary lifestyle, definitely that will make one or the other disease for your body. Not only diabetes, other lifestyle disorders will follow you.
Okay.
So
Okay.
we should be aware of that, and don't follow the hereditary lifestyle food habits what our parents have given you, because
Right.
their life experience and their life protocols will be different.
Absolutely.
So we need to focus on that.
Yeah. And go with
And-
today's
yeah.
modern times.
Ah.
Yeah, absolutely.
Yeah, modern times, and take enough sleep.
Yes.
Take enough water.
Yeah.
And evacuation is also more important.
Correct.
Don't hold all these things in your body.
Correct.
If you're feeling to evacuate the urine, if you're feeling to evacuate the motion,
Yeah.
definitely you should do that timely.
Correct.
Like that,
Correct.
we can manage the health
That's
condition.
a very, very important point, actually.
And
That's
for
true.
this, I'm going back to the same point, like what Panchakarma will do. The first one is the Nasya Karma, that will give you the medication to stimulate the pituitary gland through the nasal route.
Right.
And the next one is the MSS or purgation therapies. That also will work for some patients. Those are having more kapha,
Okay.
and those are having more pitta. And the rectal root medication, that is the Basti Karma, that will give very good results for the colon cleansing. The gut cleansing is too important nowadays, because
gut cleansing.
gut cleansing. So that will work well with Ayurveda. It's not only with the saline water. There are certain medications that is prepared for this particular purpose, and that will be given through the rectal route,
Right.
and
Okay.
that will give very good results. And some pre-operative procedures that we can practice daily, like oil applications, and from the
Sure.
clinics we can do that poultice massages,
Yes.
and that friction massages powders that
Right.
will give a very cleansed body,
Right.
and that will later on will give you the health.
That's right. And all these remedies are available at the Ayur Vaidya clinic here in
Yes.
Dubai. So
Yes, all
that's
these,
nice.
all these panchakarmas are available.
That's right. Anything else you want to add, doctor?
No, nothing else.
All tips, okay. So you heard it from the expert here. There are several remedies that can be done in the purest and the most natural process, which is Ayurveda. You have expert doctors here at the Ayurveda clinic in Dubai. So if you are one who is having diabetes, if you're, or it's your loved one who has diabetes, you know where to go. Just contact Ayurveda clinic here in Dubai, and the expert doctors are here to help you out. And not just diabetes, anything else. I'm a personal advocate for Ayurveda because I love the natural remedies that are available, whether in your house or in certified Ayurvedic clinics, and they are sort of the best way to take care of your mind, body, and soul, so to speak. So thank you so much, Dr. Lysa, for coming and speaking. And just to let you know, we have Dr. Lysa coming back for 2 more episodes with us. So stay tuned, watch our channel, Arc Talkies, and you'll know more about what we're going to be talking about. For now, it's a wrap from me, Anjana Kumar. Thank you so much for watching Arc Talkies.